Okay, I'll go ahead and start. Hello, and welcome to the Reproductive Justice Polling in the South, What Black Women Think in Tennessee and Mississippi. This is a conversation for Black women by Black women in the South on issues that prevent our progress. Thank you all for joining us today. Today's programming is hosted by SisterReach, a Black-led reproductive justice organization in Memphis, Tennessee, and in our own voice, National Black Women's Reproductive Justice Agenda, the only national reproductive justice organization in the country. My name is Israel Cook, the Policy Fellow at SisterReach, and I will be your moderator today. This webinar is a part of a series of polling briefings for SisterReach's Deep South Policy Network. The Deep South Policy Network is a network to provide policy support to individuals, activists, groups, and organizations in Kentucky, Tennessee, Alabama, Mississippi, and Arkansas. Now more than ever, it is important to highlight and uplift the voices and lived experiences of Black women and femmes in the South. The polling of Black women in Tennessee and Mississippi by In Our Own Voice, National Black Women's Reproductive Justice Agenda illuminates the concerns and opinions of Black women. Polling and research of Black communities by Black people is rare. Surveys among Black women at the state level are almost non-existent. The goal of In Our Own Voices polling data is to provide a resource for policymakers, media, and other parties who want to understand the lives and views of Black women in the South on issues related to reproductive justice. Today, we are joined by Marcella Howe, the founder and president of In Our Own Voice, who will present the polling data. After her presentation, we will then have a discussion surrounding the findings with Sharice Scott, founder and CEO of SisterReach, Senator Ramesh Akbari, State Senator District 29 of the state of Tennessee, and Cassandra Welchland, the co-convener and state lead of Mississippi Black Women's Roundtable. Unfortunately, Roy Bertram Roberts from Mississippi Freedom Fund could not join us today. So thank you all for being here. Before we move on with the presentation, I'm going to cover a few housekeeping items. First, the chat box will be disabled, so please use the Q&A function to ask questions. Or if you are watching from Facebook Live, feel free to use the comment section and we'll have someone monitoring those questions. Secondly, the webinar is 1 hour and we will try to leave 10 or 15 minutes for questions at the end. After the webinar, we will follow up with resources and action items for your use. We thank you for tuning in to the webinar at a time when our communities continue to be disproportionately impacted by the global health pandemic of COVID-19, as well as the ongoing reality of state-sanctioned violence. As we work to build a future of reproductive justice in the Deep South, we must continue to hold elected leaders accountable to the priorities of communities who remain most impacted by reproductive oppression. It is my great pleasure to introduce our first speaker, Marcella Howe, founder and president of In Our Own Voice, National Black Women's Reproductive Justice Agenda, who will present the polling results.
Thank you, Israel, and welcome to everybody, and thank you for joining our webinar. I'm going to present the findings of our poll. I should add that we actually polled in 7 states: Alabama, Arkansas, Louisiana, Kentucky, Mississippi, Tennessee, and Texas. And what we're going to talk about today is the polling results from Tennessee and Mississippi. We commissioned a polling firm, Perry Undum, to actually do the polling. And so the data comes from that. We interviewed people both online and through telephone conversations. And the margin of error, as you need to know, most of you probably don't care, is a 5.3% rate. The survey was conducted among 500 Black women per state between the ages of 18 and up. And of those, 84% in Tennessee identified themselves as being voters, and 83% in Mississippi identified themselves as voters. So we are actually hearing from Black women who vote. Next slide. In Tennessee, the Black population in Tennessee is 17% of the total population. And of that, 50% are women and girls. Next. In Mississippi, the population is 38% Black of the entire population of Mississippi, and that is 52% are Black women and girls. And so we wanted to look at those things. Some of the questions that we asked were on, go to the next slide, were on abortion rights specifically, because we know that there has been so many laws in the South that have limited Black women's access to full reproductive health services, including abortion. So one of the questions that we did ask was whether or not people wanted to see Roe v. Wade, which is the Supreme Court decision that established a women's constitutional right to have an abortion, whether they wanted to see that overturned. In Tennessee, 72% of those questioned said they wanted to uphold Roe. And in Mississippi, it was slightly lower at 63%. Next. But we also wanted to look at the different kinds of impact that abortion care or family planning or deciding to have a child had on the financial security of Black women. We asked the question about whether or not people believed that being able to decide the size of your family had anything to do with financial security. And what we found was 95% of the respondents in Tennessee and 94% of the respondents in Mississippi said that a woman's ability to plan financial future for herself and her family was very much connected to her ability to plan the size of that family. Next. And so we're going to look at some of those financial pieces. In Tennessee, 24% of Black families live in poverty. Of that, 75% of those Black families are headed by women. And what's fascinating is 85% of Black women in Tennessee have high school diplomas or more education. Next. Yet, Black women only make 68 cents for every dollar that a white man makes. And what that means over a lifetime is that Black women lose $660,440,000 because of this wage gap. And that Black women have to work until they are 80 years old in order to catch up with the same amount of money that a white man has made by the time he retires at 65. In Mississippi, 37% of Black families live in poverty. 76% of those are headed by women, and 80% of Black women in Mississippi have a high school diploma or more in terms of education. Yet they make 56 cents on average to every dollar that a white man makes, which means over a lifetime, they will lose up to $849,480 over that lifetime because of this wage gap. And a Black woman would have to work until she is 91 years old in order to catch up with the same amount of money that a white man makes when he retires at 65. Next. So one of the things we wanted to do was to ask people what kind of things they took into consideration when they were making decisions about whether or not to start a family. And in Tennessee, and this is in the ranking, we gave them a large range of options, and this is how they ranked out. Women said that access to a living wage job was at the top at 60%. Racism impacted at 55%, having affordable health care at 53%. Food security, that is knowing that they have a good source of food at 51%, affordable housing at 50%, childcare access at 49%, and over-policing at 38%. Next. In fact, when it came to racism, 48% of the respondents said that racism had a negative effect on their mental and emotional health. 38% said that racism had a negative impact on their health, their physical health. And then when we asked younger women between the ages of 18 and 34, 63% said that there was a negative impact on their health and their emotional and mental health. When we asked about over-policing in Tennessee, 38% of Black women said over-policing factored into their decision about having a child. 58% of younger women said that it factored into their decisions about factoring in about having a child. And if you look at it, that's 20% higher for younger women. Next. In Mississippi, we asked the same questions. Respondents said access to a living wage job, 62%, racism, 59%, affordable health care, 58%, childcare access, 54%, food security at 53%, and affordable housing at 51%, and then over-policing at 43%. 52% of the respondents said that racism had a negative impact on their mental and emotional health. 40% said that racism had a negative impact on their physical health. And 61% of younger women, 18 to 34, said that racism had a negative effect on their mental and emotional health. When we asked them about over-policing, 53% of Black women said over-policing factored into decisions about having a child. 62%, however, of younger women, 18 to 34, said that over-policing factored into their decisions about having a child. Then we asked them questions about how they would like to have, if they were looking for reproductive health care services, including abortion services, what kind of healthcare, what kind of reception would they like? 78% they said they would like the experience to be simple in Tennessee. 68% in Mississippi said they would like the experience to be simple. In Tennessee, 78% said they wanted healthcare professional to respect their decisions about what was best for themselves. And 64% said from Mississippi said the exact same thing. They wanted respect for their decision-making. 77% in Tennessee said they wanted the services to be affordable. 71% in Mississippi said they wanted the services to be affordable. And then they also said they wanted the services to be available in communities. That is, community clinics, doctors who they could get to for treatment. So in Tennessee, it was 73%. And in Mississippi, 61% said they wanted it available in the communities. Next. And they also said that they wanted services available as soon as possible. That is, that they didn't want to have to try and make an appointment and then have to wait weeks and weeks before they could actually get in to see a doctor. We asked them questions specifically about whether or not they thought that abortion was still legal in their state. And it was fascinating because 44% in Tennessee said, yes, it was still legal, but 44% said they were unsure. And in the next slide, I'll show you how that factored in. In Mississippi, 37% said that they were sure that abortion was still legal in their state, but 38% said they were unsure, and 24% said that they didn't think abortion was illegal in their state anymore. Next. So then we asked them about whether or not they thought abortion rights was at risk. 57% of Tennessee respondents said that they thought abortion was in our country was at risk. And then 54% thought that it was at risk in Tennessee, and that they felt that it was becoming harder to get an abortion in Tennessee for a number of factors. In Mississippi, 67% thought it was at risk in the country at large. 72% thought it was at risk in Mississippi itself. And 49% said that it was becoming harder for various different reasons to get an abortion in their state. Yes. We asked them about decision-making. Who should make the decision about whether or not a woman could get an abortion? And overwhelmingly in Tennessee, 66% said a woman should make that decision. And 57% in Mississippi said the woman should make the decision. We also asked them about whether or not they would support candidates who supported abortion rights. In Tennessee, 59% said yes. In Mississippi, it was just barely the majority. 51% said yes. So then we asked questions about abortion stigma, because as we know, there has been a lot of attacks on Black women seeking abortion care. And so we wanted to ask people about stigma around abortion services. 66% of Tennessee respondents said that they did not see abortion as a religious issue for them. 54% said in Mississippi said they did not see it as a religious issue. In Tennessee, 81% said that they thought abortion was a responsible choice for them. 73% in Mississippi said that they believed that it was a responsible choice. And then 83% of Tennessee respondents said that they rejected shame around abortion, that they did not find, that they rejected the stigma that people were trying to put on abortion care. And in Mississippi, it was 75% also made that statement. And so now I'm going to stop and turn this back over to Israel, who will introduce the panel discussion.
Thank you, Marcella, for highlighting these important findings. We will now move into a discussion with our panelists, Sheree Scott, Senator Agbari, and Cassandra Welchland, to give their perspectives on how this data is important to Black women, femmes, and the communities they are a part of in the South. We will hear responsive remarks from each panelist, and a discussion will follow. Each speaker will have around 3 to 5 minutes to respond broadly to how this polling data speaks to their community and political organizing and advocacy work. And then we'll pose some more specific questions and then open it up for Q&A. So we're going to start out with Sheree Scott, founder and CEO of SisterReach.
This has been really great. Thanks so much for everyone who is tuning in, and we appreciate the partnership with In Our Own Voice National Black Reproductive Justice Agenda. Now, of course, if you follow the way that we do our work here at SisterReach, I always want to make sure that folks understand, the work that we're talking about and why we are approaching this work from the vantage point of reproductive justice, which is a human rights framework. So I do want to just lift up just a few things, for especially understanding that folks who are on the webinar who follow our work are probably a bit more educated about the framework, but those who are looking on Facebook from our various pages, I just really want to bring you up to speed so that you understand that the work that we do at SisterReach is not just abortion centered, but it's really important that we address the issue of abortion from an intersectional understanding, right? So I want to just first talk about reproductive justice itself, being a framework that was created by Black women to center the lived experiences of ourselves around issues of reproductive and sexual health. We're wanting to make sure that we are trying to support the liberation and emancipation of vulnerable populations from all forms of reproductive and sexual oppression. And making sure that we challenge our analysis to expand beyond just a single issue and make sure that we are being inclusive of the myriad of issues that hinder folks from being able to make the choices for themselves, for their families, and for their communities. And so then what Marcella has laid out through this polling data has given us an understanding, right, has set the foundation of understanding the various issues that impact and impede folks from being able to not just make decisions about whether or not to not have a child, but even to have a child, right? And so for those of you all who follow SisterReach, we appreciate you. And I want to lift up an idea, right, that controlling bodies controls entire communities, right? If we are expecting people to make decisions about their bodies whether we're talking about having children, not having children, putting their kids up for adoption, taking on somebody's child, foster care, whatever element we're entering into parenting, we've got to think about the fact that when we have laws that impact people's ability to be self-determining, it absolutely impacts their ability. We talked about financial security. We've talked about the fact that we have disparities in living wage. And this is something in Tennessee and Mississippi. This is very intentionally why we have partnered across the aisle with other sectors of human rights who are fighting for things like the Fight for 15 campaign, correct? And then even with the Movement for Black Lives and trying to make sure that we are present in the ways that we can support around anti-racism, anti-Black violence. So understanding that racism has a negative impact, especially thinking about issues like food and housing and healthcare, childcare, over policing. We're in the midst of protests all over the world with the focus on America and the criminal justice system and the ways in which it impacts Black communities very specifically. And so something that I've even said in the past that was taken and perverted to be something different was that for many Black women, we have abortions because we want to be in control of when and where our children are going to be taken from us. You see what I'm saying? So for many of us, an abortion is an act of love. If my child is going to leave my home and be shot down in the street, lay in the street like an animal, if somebody's going to put their knee on my baby's neck and allow the breath to leave from his or her body, we want to be in control of what's happening in our communities. And the bottom line is that we're not being able to do that. And so if somebody's going to impact our communities, impact our homes, shoot us in our sleep, kill us when we're in our homes relaxing, kill us just because we're trying to go to the store and get Arizona iced tea and some Skittles. These are issues that we are also considering when we are thinking about if and when we're going to be parents. And then thinking about our reproductive health care and lack of access, which is also what was raised to the top in what Marcella had to say. Thinking about the fact that folks want to make sure, Black folks want to make sure that their services are available. They want to make sure that they can get to their doctor in a good time frame. Understanding that issues like a 48-hour waiting period that impedes folks' ability to be able to access the healthcare they need the same day that they see their doctor is a disparity that we've been trying to push back on in the state of Tennessee, as well as working across the southeastern region to ensure that people have the access that they need. And then folks being unsure about abortion access, which means, as far as we're concerned, that the work of the conservative right, coupled with the media, is impacting our understanding about whether or not we can access not only abortion services, but health and any type of health and wellness, right? And so we got to be able to think about the ways that the media messages impact Black women's ability and Black people's ability who give birth, their understanding about whether or not they can access the healthcare services that they need. I was very interested in hearing, especially since we're in the Bible Belt, that many Black women do not think about abortion as a religious issue. However, understanding that in the South, we're talking about mostly male, mostly white, mostly evangelical legislators whose religious views, I'm not going to necessarily say moral values, because I think that word is up to the understanding of the person who says it, right? What you believe is morally right or wrong may not be what I believe is morally right or wrong. But understanding that this is the way that folks have framed that these legislators are crafting public policy around the way that they believe their religious views, and are using that as a barrier method to thwart people's opportunities to get not just healthcare, not just sex education, but also a living wage, also abortion access as a continuation of the spectrum of healthcare coverage. And doing all of this in Jesus's name, right? Doing all of this with this understanding that they have the moral high ground to set the stage and inform religious freedom and religious access, whether we're talking about the Hobby Lobby case that we've seen about 5 years ago, and even up until this moment, being able to inform those types of policies and access based on one person's point of view, one person's piety, cannot be the way, right, that we can, it still impedes on other folks' religious freedom, whether they be people of faith or not, because we've also got to think about Bible Belt or not across the South, that we're still talking about the fact that everybody is not Christian. And for those of us who identify as such, we still may not fully align in the ways that folks who are trying to pimp and use Jesus to manipulate and destroy, to harm, and take away folks' rights is not only unconstitutional, but it's ungodly. So, we want to be able to lift up that these issues that are intersectional, these multiple oppressions that inform one another at the same time, is the kind of micro, the macro understanding, and that some of the ways that it's impacting us in micro ways is through abortion access denial, or fully trying to annihilate our access to abortion care. So I will stop right there, and I'll pass it on to the next speaker.
Thank you so much, Sharice. Now we'll hear remarks from Cassandra Welchland, the co-convener and state lead of Mississippi Black Women's Roundtable.
Good morning, everyone, and Sharice and Marcella. Thank you all so much for inviting the Black Women's Roundtable and bringing Mississippi Black women's voices into this conversation. It is so important and timely right now, given that we are living in these two pandemics of COVID-19 and then also racial discrimination. And we know that this is, as Sharice say, and I just want to high five you and give you an amen on all of what you have said, because we know that this is deeply, these issues are deeply ingrained in our history and in just the fibers of the South in particular, well, this country, but also in the South, where it lasted so much longer than anywhere else in the country. And we still see the residues and the realities of how racism and gender inequality really impacts Black women. I just want to say I do lead the Mississippi Black Women's Roundtable. We are an intergenerational network of Black women and girls across the state, working to increase the civic participation of Black women. I was so glad to hear that, because it just reaffirms what we already know, that Black women, we vote. We vote in this country. We vote in Mississippi. We have the highest voter turnout in the country around presidential elections. And so our work is to increase that in every election, from the local all the way up to the state. And so it just reaffirms that. And then we also work to push public policies that are equitably and just, that represents our families. And so we are just really excited to be a part of this conversation. In 2014, myself, along with the Mississippi Low Income Child Care Initiative, co-founded the Mississippi Women's Economic Security Initiative, that really rooted all of what you all have said at the intersections of race and gender. And really looking at what Mississippi women needed in order to be economically secure. And that work has continued. And so this polling data is still very much relevant to what we learned back in 2014. It's still very much the same. And we launched the Women's Economic Security Initiative because we really wanted to understand what is it that women needed in order to take care of themselves and take care of their families. One thing we do know is that Mississippi women, we are the economic drivers of our families and the broader economy. We are the backbone of Mississippi's economy. Mississippi women work in low-wage jobs, but yet we're 2/3 of the minimum wage earners, right? And so half the workforce, but 2/3 of the minimum wage earners. And so it is so important that these issues are lifted up, and that there is actions behind correcting some of the wrongs that have been done that continue to put our people into poverty, which I call economic injustice, which is really what poverty is. And so just listening to the polling data, we released a report with the National Women's Law Center, and we know a couple of things. We know, as Marcella talked about, is around what the wage gap is in Mississippi. It is the highest one in the country. As she said, making 56 cents on the dollar. And I just want to share a little bit about what that really looks like for our Black women in Mississippi, which we are on an annual basis, we are losing over $21,000 a year. And so this is what that could pay for. And this is, and the wage gap is just not about the woman, it's about her family and it's about her community, right? And so that means 29 months of rent at about $740. That also means that could pay for 55 months of childcare. That also means 59 months of healthcare insurance premiums, which is about $428. That's how much she is losing because that wage gap is so wide, right? And so you're talking about the child not able to get, be in childcare, which also impacts the mom's ability to go to work. And so all these things connect to each other, which is the pocketbook question, right? That's on the table. And then she can't retire until she's 91. Like, what sense does that make? And so we are pushing the envelope even more to bring accountability and put Black women's voices front and center on the policy table, because we understand that policy impacts people's kitchen tables. And so we created this agenda, and we are making a demand on what is important for our families based on what we know we heard from Black women. Just recently, myself, the Mississippi Black Women's Roundtable, along with the University of California, San Francisco, and two amazing social workers, Dr. Nellums and Dr. Olga Osby, we actually did a very similar polling to this. And we actually conducted it about probably, we had about a little over 60 women, Black women, all across the state. And we did the polling, we did 34 interviews, in-depth interviews, and we did 6 focus groups that were about 35 women in those focus groups, ages 18 and older. And it was very similar to what Marcella discussed. And the study really explored the contraceptive care experiences and preferences of women in Mississippi, and to fill the critical knowledge gap around how best to meet these women's needs who face barriers to quality, comprehensive care. And there was a couple of things that was really, really, interesting in this data. The analysis indicated that Mississippi women encounter numerous structural challenges to accessing quality care, including the cost, including the lack of childcare and transportation, the lack of healthcare coverage. And we know that Mississippi is one of those states that did not expand Medicaid. And we know that that is so critical and so important right now. Some of the other things was the negative experiences they had with their providers and their staff, including racial discrimination, increased visit coverage. One of the things that I would say, just as a Black woman, it is so important, and you all know this too, so important to have a healthcare provider that you feel comfortable with. And when you have limited access, you don't get to choose all the time who you get to be your doctor. And for me, because of a negative experience I had at the age of 18, I cannot see a white male doctor as my OB because I had a very negative experience. And we heard some of this in these interviews with these women. And when she doesn't have access to and a choice to choose who her doctor is, then all kinds of things can come up from that. And we heard some of that, and we'll get an opportunity to share more of that data and more of those conversations as we roll this out. But it's so, we know that racial bias is really weaved into everything that you all talked about here, but also in the work that we have continued to do. Pregnancy accommodations is so important, right? That's a woman's right, because we as important as a pregnant worker, she needs to be on that job. And it's a critical time because, and we know that so many of these workers are low-wage workers, but she also needs pregnancy accommodations. And that was one of the issues that we're working on. And pregnancy accommodations is important because we need that mama to be healthy and to live, and we need that baby to live as well. And so we need public policies, and we need state government that also provide some laws in place that will protect that mom and protect that baby. And so these are some of the things that we have been working on. These are some of the things that we think is just so critically important as we work to change policies, change laws, but also speak truth to power around what we know Black women need in order to make good, sound decisions around their reproductive health, but also making sure that the workplace is also conducive to her, whether that's making sure she has pregnancy accommodation, making sure she has paid leave and sick leave, right? Making sure she has flexible schedules, making sure there is childcare there so that she's able to go to work. So all of these things are important to Black women so that we can take care of our kitchen tables. Because as Marian Wright Elderman says, no woman should have to choose between the child that she loves and the job that she needs, right? That's so critical. And so I'm sure we'll get into a lot more discussion as we move on, but these are just my initial thoughts. And so thank you so much.
Thank you, Cassandra. Now we're going to move on to remarks from Senator Ramesh Akbari, State Senator District 29 of the state of Tennessee.
Hey everyone, this is Ramesh Akbari. Can you all hear me okay? Okay, perfect. Sometimes I have issues with my overpriced Apple headphones. But anyway, it is a pleasure to be here with you all today. The legislature actually just adjourned last week this time with a unfortunate and just really awful surprise abortion bill, a fetal heartbeat bill that we were told was not going to be heard. It was not on the agenda. There was no notice that it was going to be heard, but through maneuvering around the Senate and House seeking agreement around the state budget, the Senate traded the abortion bill so that the House would agree to their budget request. It was pretty awful. As a matter of fact, the rules were suspended a little after midnight so that the legislation could be heard. And in spite of our objections and our fights against it, unfortunately, it did pass. The good news is it's an unconstitutional piece of legislation. And there are groups who have already filed lawsuits. And we anticipate that there will be some sort of injunction as soon as the law goes into effect that will prevent it from going into effect. The timeline, it looks like the speaker has signed the legislation. The lieutenant governor has not yet signed it. After he signs it, it will go to the governor's office, and I'm sure they'll do some sort of ceremony around it. So, I mean, they can celebrate, but again, there's nothing to celebrate. This, because it's not something that's going to go into effect. It's restrictive. It does not allow for any sort of exception for for rape or incest, which is really horrific. It is just, once the heartbeat is detected, it claims at 6 weeks, which most women aren't even aware they're pregnant at that time. They will not have the option for that type of relief. So that's kind of what we're dealing with a little bit here in Tennessee in the immediate. Of course, long term, we have issues with maternal mortality as a whole. There was a report that was commissioned in 2017 that showed that 85% of all maternal deaths that occurred were preventable. That's those numbers are staggering. And there was a list of policy changes that needed to occur so that we would not have to encounter or deal with these types of issues again. But unfortunately, I do not think a lot of those have been implemented. Another big hesitation that is really frustrating is expanding Medicaid in Tennessee to make sure that people have access to health care, preventative care, over this idea of having to use emergency rooms or other entities to receive medical care. I think it's not just they try and make it an urban problem, but it's not. It affects people across this entire state, particularly in our rural areas. So that's one of the big things that really could help. But people, unfortunately, are not willing to do it. Initially, I should say the majority party is not willing to expand Medicaid, even though they know the benefits are immense for all populations, and it would not cost the state of Tennessee anything. Another big policy decision that happened this year, we were actually pretty excited about it. It would have allowed women, after they gave birth, to have insurance, to have dental care, to have postpartum care. But when the budget kind of went into a bit of a free fall, the governor, well, I won't say the governor, but the governor and the majority parties, they decided that this was not something that was worth funding, which is pretty ridiculous because it was not a significant amount of money. I think it was about $8 million. And if you look in the scheme of a $39 billion budget, it is certainly something that could have been added to the budget easily. There was room for it. There was money that was put in the reserves instead of using it on people who need it very much right now. And so our party pushed to have that added to the budget. But unfortunately, the majority party did not want to hear it. Which is really ridiculous. Another thing that we're working on, because we've had a lot of righteous protest, and I am happy for it, because all of a sudden, a lot of my colleagues who they don't believe some of these issues exist, but their children do, and so now their children are saying, "Well, mom or dad, I have privilege," and they don't understand what that means, and so they're leaning on Black legislators, which is frustrating to a certain extent, because it's important to have the conversation, but it's also extremely exhausting to have the conversation. And so we've tried to use this moment to demand, or at least negotiate with the governor's office, to do more things to support those economically in our communities. For instance, they could easily, there was a study that was commissioned, and this was 11 years ago, that showed that less than 1% of all contracts on a state level were with minority businesses. And that was under a Democratic governor. So we really, I'm not saying it's one party or another, it's about priorities. Because even at one point when Memphis had a Black mayor in the city and the county, a Black member of Congress, majority Black delegation in the state house, majority Black school board, city council, and county commission, minority contracting, Black contracting was still less than 1%. So this is a universal problem. And so we were trying to push him to implement more procedures, particularly around construction, transportation, but also other departments that you really could make a lot of businesses move from struggling and surviving to thriving. And all they need is an opportunity. They have the ability, they have the knowledge. So to that end, we've been pushing the governor's office on that. Another thing we're pushing, and this is really important for our Black banks, to have accounts, state accounts, these massive accounts actually housed in Black banks, which will allow these businesses to give better loans or have more ability to give loans to small Black businesses. Because we're not just talking about, it's a whole picture. You have to have economic stability, economic thriving, not just surviving. We have the healthcare piece, which they have not tried to help with that in a way that they could. Sorry, I'm getting a FaceTime. That was weird. Which in the way they could for insurance being guaranteed for everyone, and certainly issues of maternal health and mortality. Again, they're not doing the right thing when it comes to that. But that does not mean that we're not going to continue to pressure them. A piece of legislation that we did pass, which I was happy about, guarantees prenatal and postpartum care for incarcerated women. This has to do with nutrition and also medical care. Now, the state was already doing this, but it was not in law. They were not required to. And our local prisons were not. Another bill that we're working on, and we had support in the Senate, but it died in the House. And when the COVID crisis hit, we couldn't address it. And that is the shackling of incarcerated women when they're giving birth. I mean, it is ridiculous. It is dangerous. It's unnecessary. The state, just so you all know, is not doing that practice, but our local jails are. And there are women who have actually died during childbirth and been able to sue our local governments because of it. And that has been something that we're hoping to use to push this legislation. But it's not an easy environment to be. I mean, for the first time ever, we have 3 Black women in the Senate, which is the first time ever. I mean, there's usually only been one. It's not an easy environment to be in. We fortunately fight every bad piece of policy and fight for good pieces of policy. We do not give up, even though we're outnumbered. We try and find middle ground when we can, but when we can't, we just have to raise our voices against what's going on. And also, there's more opportunity, I think, though, at our local governments, because they do have the majority on those bodies, in Memphis at least, where they can make some effective changes. But again, we're here on a state level fighting for women across the spectrum, women who how do I say this? And it's even manifest in the legislature, who are often overlooked and who are not taken advantage of, but taken for granted. Okay, and so our goal is to make sure that economic opportunities, healthcare, education, and all things that can kind of help make a person whole are extended to everyone. So with that, I'm going to stop talking and let one of our other panelists talk. Thank you, guys.
Thank you, Senator Ansari. So now we're going to open it up for Q&A, and I'll lead off with a question until we get some audience participation. And a lot of my questions have already been highlighted a little bit, but this was the one that I haven't seen highlighted that I would really like us to kind of talk about. So with the recent Supreme Court case, Boston v. Clayton County, it held the Title VII of the Civil Rights Act of 1954, which makes it illegal for employers to discriminate because of a person's sex, also protects LGBTQ workers. And I would really like our panelists, and I think I'll start with Sharif, to speak to the realities faced by Black LGBTQ plus people in the South with regards to reproductive health and overall health in the South. And then maybe you say something about what are the realities for the LGBTQ plus communities, even in the aftermath of this favorable ruling for the Supreme Court.
Sure. So I think that, speaking as someone who identifies as a Black bisexual woman, it is really interesting to see, well, first, I appreciate the question, because I think that queer folks, especially around reproductive and sexual health issues, are invisible. Especially when I'm thinking about trans men, for example, who, really never make the conversation, never are allowed an opportunity to be centered in this dynamic and understanding, regardless of the fact that trans men have babies, right? Folks who are gender nonconforming. Also thinking about, even with our program Boy Talk, trying to intentionally center masculine of center or masculine presenting women of color, as well as trans men, has been something that we have, we recognize was important for us to do, understanding that no one was necessarily focusing on that population. And I'm just not talking about just in the state of Tennessee or even here in Memphis, I'm just talking about nationwide, that this is, a neglected population of people. So when we think about the ways that these policies impact folks, I think one of the reasons that we are impacted in these types of ways is because of the level of invisibility. But then let's talk about myself, like bisexual Black women. I'm a mama, right? And many queer women are mothers. right? And we are trying to navigate what it really looks like for us to not only live out our lives, but to raise our children, in healthy and sustainable communities, that not only have invisibilized us but silence us through legislation. And so, I don't. I think that it's definitely an issue that we need to continue to be pushing for. But it also means that, this is why our LGBT community has to be, just like in any other community, it has to be far more diverse. It can't be the mainstream LGBT folks speaking on behalf of people of color, even folks of color who identify as queer or trans. And so, we've got to create opportunities, right, for these voices to be heard, to be, and brought forward in the conversation, as well as it needs to look a little different even in our maternal health world. It's still very cis, very heterosexual. I'm a part of Black Mamas Matter, the organization, and was at some of those foundational tables of the work that we were doing to try to make that work happen, right? But even we are being even more intentional as a national coalition of folks, of trying to make sure that we are being, more intentional to center those at the, who are on the margins, and that includes masculine of center, that includes trans men, and also in the work that we're doing, and being even more expansive about the ways that we think about reproductive justice, right? Over these 26 years, understanding that the framework was a very womb-centered framework in its initial iteration, making sure that we have been even more expansive in our work within our own voice, right? Thinking, how do we expand that work as well? So I'll stop there.
I just want to ditto what Sharice has said. I really don't have a whole lot to add to that, other than to say, I mean, there are definitely people here on the ground in Mississippi who's doing really intentional work to, well, I just want to say the Supreme Court ruling around that was very necessary to make sure that discrimination didn't happen to, gender non-conforming folks. And then also to, Black folks, Black women, in that as well. So I just want to say that that was definitely necessary. But there's still much more work to be done. There's folks here on the ground who's doing just incredible work to make sure that LGBTQ communities are, and I communities are really included in the conversation, making sure there's intentional safe spaces for them to be a part of changing the narrative about who they are. And I think the other thing that's been really interesting is what, Sharice says, you can't separate, that child from that person, right? And so often that's a conversation, like they don't want to see, the transgender male and that child together. Is very interesting. And that's a whole nother narrative and conversation and education that needs to happen between cis Black women, trans men. Those are the kind of conversations that need to happen, but that law is so important. And I think we can start with that about what does that do, and then begin to weave those other conversations in about how do we continue to make them inclusive and make sure that they are visibilized. I mean, that they take their rightful place just as the rest of the citizens are doing.
Thank you so much. And then we have a couple of questions in the chat box around Medicaid coverage. And so there is one that says, since it's such a critical, healthcare is such a critical issue for Black women in both Tennessee and Mississippi, have there been efforts at the grassroots level to move forward a ballot for Medicaid expansion in the way that Oklahoma and Missouri are doing now? I think if Senator Akbar would like to comment, and then Cassandra, if you have anything to add to that, that'd be great. Thank you.
Certainly. Well, the way that our state is structured, we do not have those types of ballot initiatives. So we don't have that recourse, unfortunately. It's similar to other states who have used ballot initiatives to allow marijuana laws to be passed. as the law exists right now in Tennessee, the legislature has to approve the governor expanding Medicaid. That was a law that was passed the first year I got there. It's really backwards and kind of foolish for the governor to cede his power like that, but that was the previous administration. I will say this though, we have submitted I shouldn't say we, they have submitted a waiver to get a, what is it called? It's where you get your own funds and you can kind of do what you want to do with it. I cannot think of the term right now, but it's a block grant. Yes, it's ridiculous, and Tennessee will be the first state to get it, and it really would limit those who are eligible for these programs if we run out of funds. I think CMS has to like resoundingly reject that proposal before we can move forward with a discussion again around expansion. But this crisis has shown that these hospitals in rural areas are struggling. I mean, they're closed, okay? In Memphis and in our city areas, they are not closing. They might be struggling, but they're not closing. So I think I think CMS has already said no to Tennessee, but once we kind of move beyond that discussion, we're hoping we can circle back because it really is a bipartisan issue at this point.
In Mississippi, there has been efforts to explore making that a part of a ballot initiative. Last year and a year prior to, there was definitely coalitions together talking about how we can begin to pass a ballot initiative to expand Medicaid. We weren't able to really move forward with that. Right now, where we are, not that it's off the table, because it's definitely needed, but there was during this legislative session, as there always has been, there's been effort to again expand Medicaid. Hospital associations, medical associations came out to say, that particularly in rural areas, that Medicaid needs to happen because it's, devastating the healthcare infrastructure across the state in those communities. And so we were in an election cycle, we have new leadership, and not everyone was on the same page with that. And so they did not expand Medicaid through the legislative process, the traditional one, but now that we have COVID, it has heightened even more this issue. And so now that we're getting COVID dollars in, just as we are talking about the state flags and all of, the Confederate monuments, this has become even more a civil rights issue, an economic justice issue as well, that Medicaid expansion needs to happen for everyone across the state. And so that is back on the table now as we are in this kind of a hybrid election, legislative session. And so one of the things that we actually tried to do is this past legislative session in coalition and led by Representative Jarvis Dortch, is to get Medicaid expansion 12 months postpartum. And we were able to, with a lot of coalition people who've just done amazing work, definitely went before, did committee hearings on the issue, why it was important, particularly to help with, maternal mortality. And so we've made a lot of ground in really elevating the issue. And so we hope that we're able to get far enough in the process to really expand Medicaid, whether that's through a ballot initiative or right now through this legislative process in the midst of COVID-19.
Okay, thank you so much. We want to respect people's time, so I'm going to pass it to Marcella for some brief comments, and then I'll close us out.
Well, thank you, Israel. I was just going to say that, as I said earlier, we have other states that we've done polling in collaboration with SisterReach. So there are Alabama, Arkansas, Kentucky, Louisiana, Tennessee, Texas. we've done Tennessee and Mississippi, that we will be doing more webinars and other types of presentations on, that people should look out for those notifications and things, because we've done them specifically in each state so that people who are activists, organizations that are working in those states can use those to go to their state legislators and say, this is what Tennesseans think. This is what Mississippians think. And the fact that it's such a high number of voters, that Black women make up a high number of voters, that puts more pressure on, especially for this coming election with state legislators, congressional people. And it is important to look at, as Cherie said, to look at the abortion issue in a larger picture that is an intersectional picture. That one of the reasons why reproductive justice was developed was simply because issues like pro-choice and pro-life did not reflect the lived experiences of Black women. And that reproductive justice came about because we wanted to make sure that people were looking at all of these issues that impacted Black women's decisions about whether or not to start a family or to expand a family. And that it was really important to look at housing and racism and over-policing, clean water, all of these different things that came up in the polling, to really say, this is how we make our decisions. We don't live our lives on one issue. And the polling consistently proves this when we ask people what they're thinking, so that when we are talking about issues like maternal health, we can't just look at what, whether or not someone has insurance and is getting prenatal care, but we also have to look at provider biases and how they treat Black women who come in labor. All of those kind of things do have an impact on the well-being of Black women across this country. And that's what our polling was designed to look at.
Thank you, Marcella. And then we'll have a few words of closing from each of the panelists. We'll go in the order of Senator Akbari, Cassandra, and then Cherie. So Senator Akbari, if you'd like to give a few words for closing.
Sure, definitely. I mean, I think that all is not, our issues that we're facing are very serious. And unfortunately, in a lot of our states in the South, we do not have the political numbers in the legislatures to really push forward the progressive legislation that can really help. However, I think that numbers are important, in having collections of or surveys of Black women that are saying this is important and these are the numbers we have. And these states are really good. So I'm really excited about everything I've heard on this call. And that even though we don't have the numbers that we'd like, there are certainly ways to get more Black women in the legislature. We have women who are running all the time, who are on the ballot now for state positions, local positions, school board, all of that, because it's going to take an entire structure of change for us to really see an impact. I have a leadership pack that I just formed called the Akberry Pack, and one big part of our initiative is to help elect more Black women, period, and to support them in their races, because it's one thing to put yourself out there to run for office, but if you don't have the financial and the manpower or the woman power on the ground to make it happen, then you need that type of support. So I'll send that information out to everyone as well. But, little by little, seat by seat, we are going to make a difference. So thank you all. So fortunate to be with all of these brilliant, beautiful Black women on this call. Thank you.
Again, thank you so much for having having Black Women's Roundtable a part of this conversation. I agree with everything that has been said here. The arc of justice bends slowly, but it's bending. And I just want to continue to encourage, Black women and our regional partners, because we believe that working in coalition, we're so much stronger when we're working coalition together. And this helps continue to bend that arch of justice toward economic security, for Black women and our families, our girls, our boys, our communities. And so this is exciting work, and I'm so excited to be a part of it. We do have a long way to go, but that arc is bending. And so as we continue to do this work, at the end of the day, mamas just want to go home and be with their families, be with their children, and to just take care of them and to love on them and to bring joy, particularly in this moment right now. We all need some joy. And so being able to, everyone has the right to live and earn a decent living to take care of their families. And that's what we're talking about, and to be able to choose, because that's just our inalienable right, to live in freedom and dignity and liberation. So I just want to just say thank you so much for this. If you want to learn more about the Black Women's Roundtable, please follow us on social media, Mississippi Black Women's Roundtable. We will also be talking a little bit more about our polling data that we did specifically around, person-centered care, and how do we begin to change that, empower women so that they can speak truth to power even when they're in the healthcare with their provider. So thank you so much, and look forward to many more conversations.
Thank you, Israel, for your amazing facilitation. I appreciate you holding this space for us to have these conversations today. For me, I want to just leave us with the opportunities, right? We have so many opportunities here to mobilize, to educate. One of the ways that SisterReach does our work is in this way. We are restricted because of the pandemic from being outside and convening groups of folks to come together and have these conversations face to face. But we have, these opportunities to mobilize around LGBT issues because we see those intersections, this economic disparate issues. We see those intersections, gender equality, anti-Black violence, maternal and pregnant people's health, racism, as well as the practical needs of people. Basically, what we see is that Black women are going to work until we die because there is no infrastructure in place for us to live, to thrive, to live in abundance, to have the things that we need for ourselves, not just ourselves, but our families and our communities, and understanding that we are making decisions, not necessarily for our own individual lives, but we're making decisions because of our kids. We're making decisions because of our husbands, our wives, our partners. We're making decisions because those things are informed by what our pastor says. We're making decisions because of how our legislators limit and impede our ability to make sound and wise decisions for ourselves, what we know to do for ourselves, right? And we're leaning on these intergenerational anecdotal ways to survive, right? We're not going to the doctor. We're taking care of it at home, right? And I mean, we're trying to manage high blood pressure, diabetes, lupus, breast cancer. We're trying to do that because we don't have access to Medicare, to healthcare. Right, I lost my mother in 2018, and I'm 100% sure that the reason she is not here with me right now is because she could not afford to live. Right, that one pill for her to be able to manage her liver cancer was going to cost $3,000. One pill, not the rest of the things that she had to take, but just that one pill, and she was not going to put that level of financial burden on her children and on her husband. And so she is not with us. So we basically are working until we die. We are making decisions to die because we cannot live. We are and we are doing that, right, unapologetically, because nobody's taking care of us, right? If Malcolm X said that the most unprotected and neglected people on the earth is the Black woman, this data proves that is the truth. Right. And we've only given you a snapshot of a few of the issues. There's so many other issues that we could have addressed, right? But in our own voice could not get all of that polling, right? Because what it takes to really be able to put an eyeball on every issue, is really beyond, finance, beyond their capacity to be able to show that. And so that being said, it is imperative that there be even more philanthropic investment in the work of Black women, in the data and research that is led by Black women, that there has to absolutely be a commitment, not only by our philanthropic community, but our medical community, to listen to Black women, to listen to Black people, right? One of the things that we've been doing over the last couple years is implicit and explicit bias trainings with medical providers and public health people across the country, right? As well as doing education with faith leaders and folks of faith around the intersections of social justice and reproductive and sexual health, maternal health, regular health, right? And faith. And so we're having these conversations because nobody else is doing it, because nobody else is investing in it, right? And so we've got to put those dollars where they are needed. We want to, if folks want to truly change the lives of Black folks, it's going to take money. My Bible says that money answers all things, right? And so if we're going to be able to really move this, we've got to have an investment. We've got to have a commitment, and we got to have a commitment for the long haul, especially in the South, as we continue to not only try to change the ideas and minds of those who are in power, who are mostly white and male, but even among ourselves in our own community. So we've got to continue to try to do whatever we can do to get our folks to the polls, right? I'm appreciative of the work of our legislators to make sure that we can have absentee voting ballots so that folks can still, share what we want to see happen in the White House when it comes down to this presidential election. We absolutely, this is no time to stop the momentum. We've got to ramp it up. We've got to be at those polls. We got to continue to push. We got to continue to call Governor Lee's office and say that Black women, we are pissed off. We do not appreciate you coming to our communities to do photo ops with Black preachers and then ignore the questions and the needs of Black people around our reproductive and sexual health. But you can come and do a photo op. You can come and make sure, that your white self is in our Black communities that you refuse to invest in, but you continue to marginalize and to harm and to kill us with legislative terrorism and violence. And so that's what these discussions will continue to be. We ask that even if you're not interested in what's happening in Mississippi and Tennessee, that you continue to be a part of each one of these calls, because this is going to only continue to grow and grow and grow. Right. And we want to make sure that we can mobilize not just online, but we can mobilize on the ground as soon as we're able to get out there with the Deep South Policy Network, the work that Israel leads, the work that In Our Own Voice invests in. And thank you so much, Marcella, for continuing to fight for Black women, to fight to make sure that we have the resources that we need to do this vital work in our communities. And thank y'all for listening. I appreciate you all for attending today.
Again, thank you to all the panelists. This has been really powerful, really great information. And thank you to the audience. Thank you for the participants for joining via Zoom and Facebook Live. We really appreciate the work that everyone is doing to uplift Black women in the South. These conversations and polling briefings will continue to happen, so please look out for invitation and information about those. For more information about these, follow SisterReach at SisterReach on our social media platforms and In Our Own Voice at Black Women's RJ. Thank you all so much and have a great day.